Hello everyone, my name is Dr. Shahbaz Ansari, and as of right now, I work as a clinical fellow in trauma and orthopedics in North Manchester General, and here I am yet with another video. In this video, I'm going to be talking about the top tips that new IMG doctors should be aware in order to work in the NHS in a seamless manner. So let's get right into it. So first of all, congratulations on landing your new job in the NHS, and now that you're here, the first tip would be just ease yourself into the process. Know the surroundings and the schematics of the hospital, where the toilets, where the doctor's room, where is the doctor's mess, where's the canteen, where to chill, where to meet people, where are the blood equipment taking stuff, where's the ECG. Just know your surrounding and ask more and more questions, which actually leads to the second tip, which is ask as many questions as you can, and do not shy away from asking for help, because it doesn't matter where you're coming from, another city or another country. Every place has got its own essence, and you need to be aware of what are the norms here, because you might be doing something right, but because the norms are different, so you may be doing something wrong. So you need to ask as many questions as you want. And the third thing would be that since this is your new job, and you should be entitled for a shadowing period, ideally for 4 weeks, but 2 weeks and 1 week, any shadowing period is better than no shadowing period. And from my perspective, you can learn passively and actively, whereas I personally am an actively learning person. You can learn by just shadowing and following another colleague or an SHO or a registrar, but that's not going to give you a better insight. So what you can ask them, that you do the thing and ask them to supervise you and give you a feedback, and learn everything and anything that you absolutely can in that shadowing period, because once that shadowing period is going to end, everyone will expect you to work on your own. Even then you can ask questions, but it's better to get as much clarification as you can in that grace period, because that is what it's for. Okay, so the fourth point would be knowing your limits. It is that you need to be aware that what is it that you're comfortable and confident doing. For example, if you are not comfortable doing a lumbar puncture, it's better to say no or seek assistance, or are you comfortable in doing, but you would want some supervision. So these are the things that you actually need to know about, because it's better to actually ask for assistance or say no, rather than making a huge mistakes and then facing the repercussions. Along with it, you should know your role as well, because it doesn't matter what you were in your previous role, be it a registrar or a consultant. You should act upon the role that you've been given with. For example, you're an SHO, so there are certain decisions that you should not make or need to make with the supervision of a senior, be it a registrar or a consultant. So point number 5 is actually one of the most important points as well, which is working on your documentation skills. Back in Pakistan, emphasis was not given that much on the documentation, but in this country you can't actually slide yourself by if your documentation skill is not good. And you should learn this skill from the UK graduate itself, because their documentation is meticulous and bulletproof. And if documentation is not good, you're going to be in a lot of trouble. For example, you had a scan or bloods to chase, and you got super busy and you handed over to your colleague and you didn't write it. So if it was not written, it was not done, and then you'd be the responsible person for chasing those scans. And if those scans were not chased, you'd be the person responsible. So yeah, documentation, it is very, very important. So the 6th point would be, it is something which is not given that much importance, but remembering to take adequate breaks is actually something of a vital role, because you need not to exhaust yourself, because by the end of the day, it is NHS and there's always going to be work, and if you don't do, somebody else is going to do it. So you need to take your adequate breaks so you don't exhaust yourself, and is actually good for your mental health as well, and it rejuvenates you so you can work in a good manner and make minimal mistakes. The 7th thing is actually something which is going to help you in day-to-day life. It is to know your guidelines. Every hospital has got a different guideline, be it trust guidelines or GMC guidelines. For example, what antibiotic to prescribe post-procedure, what antibiotic to prescribe in a UTI, how do you manage a chest pain, what is the HHS criteria, and stuff like that. And you need to ask it from your colleagues or go into the hospital intranet to make yourself aware, because you never know when you're on call and you need something of a guideline to act upon, you know where to go. Okay, so knowing your trust guideline is actually very important. The 8th thing would be is to get to know your supervisors, be it your clinical supervisor or your educational supervisor, because they are actually your godfathers in this role. They're going to help you on any courses that you want to do. They're going to help you in guiding any exams that you want to give, and actually give you advice on your career as well. If you are looking into surgery or medicine, it doesn't matter. So this is something which need to be discussed with the supervisor, and if you are in good terms, they can actually go above and beyond to help you and assist you in getting what you want. Okay. So point number nine may sound like a cliche, but you need friends. You need friends to socialize with. You need friends to blow some steam off and to talk about your daily day, and by the end of the day, it's actually good for your mental health as well. So I would emphasize on making friends. And it does not hurt to say hello, because everything starts by saying hello, or as the locals say, saying you okay. Last point actually would be to formulate a plan from the career aspect in a timely manner. It depends what you want to become, be it a surgeon, a medical personnel, or a radiologist, and you need to make a portfolio and work through it and try to achieve the things which actually matter in order to achieve what you want to become. And hopefully I will be making a few small videos which are going to help you in that perspective. This brings us to the end of the video. I hope this was helpful. Please let me know what you think about it, and like, comment and share, and tell me if there's any other thing that you would want me to talk about. I would be happy to help. Till then, see you later. Bye bye.